Good morning, everyone. So great to see you all. Thank you for being here. I would like to call this meeting to order on June 18th at 8:07. We will, following the agenda that you received, we're going to skip the approval of the minutes for June 20th until we have quorum, and then I'm going to move to the next agenda item, which is the Joint Community Health Improvement Plan update with Dr. Madi. Dr. Madi, I'll turn it over to you.
Good morning, everyone. I hope everybody is doing well. It is a beautiful sunny day. Public health is just thriving in our region, and you will hear more about that later. I'm really pleased to introduce to those of you who are new to this board, Rhonda Bartow, who I think I add a year every 2 months that she's been in the city and make it more dramatic because she is one of the OGs, as I lovingly call her. We have a few OGs in the Department of Health. Rhonda is one. Rhonda, it's been 56 years. I'm kidding. It's been like plus or minus 30. It's 30, right? 35, right?
35 years.
Girl, I was going to shave years off. I was going to give you 31. So I'm not as dramatic as I feel. 35 years. I need you all to just sit with that for a second. That is an incredible amount of dedication, loyalty, and leadership. And so she brings a lot of wisdom to me personally into this office. I will let her say her formal title, but she leads all things QI and most importantly, reaccreditation. Being that we have a lot of new board members, she's going to do a little bit of a recap from what some of you have heard to let you know what we have gone through over the last 3 years, a mammoth effort that she and her team have led around reaccreditation and the CHA chip. And then she'll talk to you about what's happening this year, next steps, and open it up for discussion. So for new board members, this is pivotal because this may be the single most important activity that we do to keep our health department open, but more importantly, to align with the region around priorities for public health, and doing so in a truly collaborative way. And I would say this last 3-year round is the most collaborative that we've seen. So really excited for Rhonda to give you a brief 10-minute presentation, and then we'll open it up for discussion. Thank you, Rhonda. And just more of an introduction to your title, Rhonda, and your 35 years of amazingness. Over to you, Rhonda.
Thank you. As she mentioned, my name is Rhonda Bartow. I'm Health Service Manager 1 with the City of St. Louis over quality improvement, strategic planning, and accreditation efforts. So I'm going to pull up my presentation real quick here. Okay. Can everybody see that?
Yes.
Okay. So first, I want to tell you a little bit about the Community Health Improvement Plan. It's a strategic plan for the community that guides the improvement activities collaboratively in the St. Louis region. It is based on a collective impact framework and is developed by the Partnership for a Healthy Community. This collaborative partnership includes numerous representatives of the public health system in the St. Louis region, both city and county, such as not-for-profits, businesses, academia, hospitals, etc. They design activity plans and implement and support the goals and objectives within the CHIP. These work plans serve as living documents that are updated as needed to move the work forward. The partnership is facilitated by a leadership team of employees from both city and county health departments. And the CHIP is a requirement for us meeting FAB accreditation standards, and it is to be driven by data from our community health assessment. Our community health assessment, also known as the CHA, is to determine the health status of the region and the residents, and to understand the factors that contribute to health issues. It is consists of 4 assessments that are part of the MAP Framework, that stands for Mobilizing for Action and Planning and Partnership Framework. This process consists of 6 phases. If you can see here to the left, we started out with organizing and developing our partners. Then we went into developing a vision, which is to see St. Louis as an equitable community achieving optimal health for all. And now, then we did the 4 assessments. The Forces of Change assessments gathered information on social, political, and economic factors. The Community Health Status Assessment was primarily developed by our epidemiologist, and it used data gathered throughout the region. A Community Themes and Strengths Assessment was captured through residents in the St. Louis City County region. We did about 16 focus groups and of vulnerable populations. And then we also did a regional hospital collaborative community health needs survey. And then the last assessment done was the local public health systems assessment, which identified the strengths and weaknesses of the region's public health system and its capacity to provide the 10 essential public health services and improve health equity. And from these assessments, the advisory team used that data and developed 5 priority areas that we are to focus on for the next 5 years. They also considered cross-cutting themes to cover all these priority areas, which were considered and which are to be considered as part of the plan development and design of the activities in the work plans. These cross-cutting themes include access to systems, physical accessibility, interventions across the lifespan, participatory and community-driven approaches, racism, equity, and trauma-informed processes. For each of the priorities, as I mentioned, we have 5: the intersection of health and economic mobility, chronic diseases, maternal child health, violence prevention, and behavioral health. And they are led by co-leads. The violence prevention co-leads are Serena Muhammad and Jessica Meyer. They have a primary goal of reducing non-fatal shooting incidents by 25% through increased coordination of community level response, implementation of prevention practices, and increasing community engagement in a holistic approach to public safety. Our next action team co-leads for chronic disease are Rochelle Bartnick and Lauren Lanford. Their goal is to increase healthy food availability, accessibility, and utilization measured by increased coordination, unified systemic nutrition security solutions, increased participation in food assistance programs, prioritizing food and nutrition in healthcare and management of chronic diseases, valuing nutrition as essential in hunger relief and food assistance programs, and reducing the food desert footprint. Our next action team co-leads are Dr. Elizabeth Daniels and Rose Anderson Rice for the Maternal and Child Health Action Team. This team's goal is to address racial disparities to reduce morbidity and mortality to improve maternal and infant health. Then we have the Behavioral Health Action Team with co-leads Risa Rollins and Meredith Childs. They have 3 goals. One is to improve behavioral health and wellness through the availability and accessibility, affordability of integrated and consistent coordinated patient-centered care through policy changes. 2 is to improve behavioral health and wellness among vulnerable populations through education and community navigation. And 3 is to increase availability and accessibility of behavioral health services by using system-level navigation and integrated, coordinated, patient-centered care in the St. Louis region. And last but definitely not least is our intersection of health and economic mobility. This is co-led, well, it was co-led by Dr. Julie Gary and Dr. Tim McBride. Tim McBride, as we all know, has taken leave for sabbatical. So we have that vacancy that we're still looking to fill. But the goals of that team are to build a coalition infrastructure for this team. 2, to implement opportunities to increase overall wealth by reducing the cost of housing and housing-related resources. And 3 is to implement opportunities to increase overall income by increasing employment, education opportunities, improving wages, and reducing barriers as necessary. The current activities that we have taking place are with our CHIP action teams is one that new members are being sought and added to further the goals of the CHIP. Action teams have narrowed down 2 to 3 objectives to prioritize for year 1, and they're developing milestones to measure this progress on those objectives. Action teams are having small group meetings with organizations supporting the plans, confirming ownership of the activities listed within the plans. We are refining data collection and performance metrics for those activities. The CHIP leadership team is updating and revamping the Think Health STL website. We are designing reporting mechanisms for the CHIP action teams and to monitor their progress. And we've also partnered with iHeard at Washington University to improve data collection from the community, to provide education and clarify misconceptions in public health, and then to also link the community to resources. And lastly, of course, we have ongoing quarterly meetings with the CHIP leadership co-leads, and it's to help organize agenda, discuss challenges, assist with facilitating CHIP activities, and to discuss and provide data needs for those action teams. As I mentioned, this CHIP and CHA are both required for accreditation. And like many of the standards for reaccreditation, we are required to engage our governing entity and our Board of Health in the process and monitoring of our plans and policies. So part of that accreditation requirements include participation in the development and monitoring of the CHA and CHIP, providing input into the needs of the community, linking us with partners in the community who contribute to the success of our plans, monitoring of the data from our performance management system on our program's performance and how we meet our targets through monthly reports that the Director of Health gives, advising on the development of our strategic plan, our mission, our vision, our priorities, monitoring our progress through regular updates and the annual impact report, providing expertise and guidance on policy development, advising on general operations to improve the health department and its vision of an equitable community for all to achieve their optimal health and quality of life, and contributing to our accreditation process and site visit. And with that being said, I just wanted to touch base on the status of our site visit. Currently, it's a 7-step process. We've submitted our statement of intent, our application, and uploaded all our documentation to support the standards and measures that are required of us. And we're now at step 4. We're planning for our site visit. Our site visit is scheduled for August 28th and 29th from 8:30 to 12:30. The logistics and the agenda will be provided by our FAB specialists on August 8th after the site visitors have finished reviewing all our documentation. We have 2 site visitors that will be taking part in this 2-day virtual site visit. And the FAB specialist will also be there for being a technical advisor. Specific measures for the site visit team that are not known yet, but we hope to get some guidance on August 8th as to what questions we might be receiving from the site visitors and what individuals we might need to address those questions. Representatives from the governing body are expected to attend a 30-minute meeting on the morning of the 29th. So we are asking to have, if available, the chair, the vice chair, and any long-term members are welcome. Anyone's welcome, but also specifically if you've been a member for a while that have a little bit of history, that would be helpful. We'll send more information out about that. And then I won't, the other thing is I've got 2 slides in here. I won't go over in detail. One is basically the purpose of the site visit and a little general information about the site visit. And then another is some mock questions that site visitors have asked in the past that might kind of help you understand a little bit more about the site visit. So now I'm available to take any questions.
Thank you so much, Rhonda. That was a brilliant presentation. If you could transfer it to a PDF and email it to me so I can get it out to the board with their monthly report tomorrow, that would be fantastic. So I need everybody, if you've been playing solitaire, if you haven't had your coffee, to shake it up, shake it up. We're going to have a really active discussion because this is probably one of the most pivotal areas that we need support from the board, and we have a brand new board. So I do not want, when it comes time for the accreditation body to meet with you specifically, because you'll be asked to attend these meetings, for it to look like we haven't done the amazing work we've done only because you feel like you're a deer in headlights. So this discussion is primarily for you to ask questions. How can we support you? How can we prepare you? How can we put the best foot forward for city and for the county and for the region, because there's been so much work. So I'm going to break this discussion into a few pieces. Just to ask any general questions because my girl is ready. I saw you taking notes, Liz. Talk about some note taking during a presentation. I was like, there goes Liz. Take those notes, Liz. So I'm ready with questions. And then I'm going to put up the slides on what your responsibilities are so that we can have a little bit more of a deep dive into how we can support you, prepare you where you think there may be gaps. We can send information to prep you. We can have you come visit the health department and meet with different leaders yourself. In person or virtually. We're willing to do what we need to do. This is a phenomenal discussion. The last thing I want to do is acknowledge members of Rhonda's team who are on this call today, some newer, but some who are also OGs, who were pivotal in this process. Shantae Fluellen, who you all know, worked with Rhonda on this when she came back to the health department. She, as you know, she's subsequently been promoted and oversees community outreach and communications, but she was a pivotal part of this team. Craig Schmidt, OG, was a huge part of this team, has been for many years, huge partner, really navigating relationships across the region, advisor. Natalie Torres Negron is one of the newer faces to this team. Natalie, if you could unmute. Natalie was also promoted from a separate part of the health department. As you know, I invest, mentor, promote big on that in the health department, our young leaders. Natalie is a shining example of that. If you could talk about your title, what you're currently involved in, Natalie.
Unmute.
We can't hear you, Natalie. I don't know what's going on. Your mouth is moving beautifully, but we can't hear you. And you're unmuted, so it could be your headset, maybe? So now you're mute. Yeah, nothing. I know, girl. The haterdom of the technology. There you
Can
go.
you can you
Now
hear
it's
me?
going out again.
Oh,
Yep, you're back. You're back. Go ahead.
I'm back. Okay. Good morning, everybody. My name is Natalie Torres Negron. I've been working for the department for a little bit now, but I'm now working in the capacity of assisting with the FAP accreditation, QI implementation, and all that comes is a whole packet. Everything that you have related to the ship, regional activities, how we connect those with other community partners as well with the department, and mainly making sure that the department is doing what it needs to do to provide the services to the community. So that is part of my role. I've been in the department for a little bit, so I feel like that experience allowed me to see other things and things that it can be improved. So I'm very excited to be part of the team.
Just a champion. So thanks again to Rhonda, the entire team. And I'm going to go to questions. Liz, you are up first, and then I'll come to you, Colleen.
Great, thank you. So I have a kind of a naive question. I'm new here. The community health needs assessment that the public Department of Health does and the work that you do, how does that connect in with our different health systems in the region who also do their community health needs assessments? And how do you partner with them to, I guess, kind of holistically tackle these challenges?
Yeah, I'll tackle first, and then Rhonda, if you can come in after me because you have more information. I'll say I get this question a lot. It's a point of aspiration. I think that the region is like, we should all be doing our accreditation at the same time and integrated. Unfortunately, historically, the timelines have been at different times. So it was a mammoth effort to make sure that we were in alignment as much as possible with the county. It was a nightmare. I'll be honest, as much as we play well together, they have a different type of health department than we do, aligning with someone with completely different maybe priorities indoors, and then a different way of doing things. So I really credit Rhonda and the leadership team at the county, but even that was a challenge, right? Because especially when you have different actual submission day deadlines, being in alignment, trying to be a good partner, but to selfishly want to take care of your entity can be challenging. So if you can imagine that at a hospital level, and their system is completely different, but you're absolutely right, Liz, in that this region will never improve in its goals around health and public health if the systems are not speaking in alignment and really understanding how we do things. So practically and right now, we're not in alignment with each other's process, but a lot of things have happened in the last couple of years. Rhonda has great relationships with all of the systems. Often the entities that have gone through accreditation are actually meeting with, mentoring, giving advice, giving all our information as is to the next round of individuals. So there's a sharing of knowledge that way. We are really talking at my level and hospital leadership level about trying to get aligned so that this is more of a comprehensive plan, but they're just starting their reaccreditation now. And a partner texted me in a meeting and was like, why aren't the public health departments at the table? Same thing you asked, right? So there's a lot of conversation about that. But lastly, some of the entities that bring us all together, like MOSIFI and other groups, have started these summits around reaccreditation that bring all of the leaders together. There's one next week, the first of its kind, that MOSIFI is bringing all of the reaccreditation specialists in our region, hospitals, public health departments together, sitting at one table, teaching each other, talking about the barriers, talking about how we can collaborate. So that is happening outside of some of the formal processes, but I'll let Rhonda bring this home because she probably has a better answer than me.
No, that was an excellent answer. I just want to add to it that our community health assessment is utilized by the hospital system as they develop their improvement plan, and most of the priority areas are aligned. A lot of times we will have chronic diseases like is one of our priorities, and they will have the same priorities are in that field area. So the other thing is we utilize their community needs assessment also and looked at the data they had got their last round And so, and that assessment and data helped inform some of our decisions too.
So I challenge the board again. This is a relatively, like I said, new board. You're really blessed to have OGs on this board by way of Melissa, Colleen, Enball. Kristen has served on this board prior to a lot of you newbies, but there has to be a little bit more conversation, I think, with April and Kristen coming to this board about how you wield your power. It's not just about listening to us, learning from us, asking a few questions, reading a report and calling it a day. It's about what actionable items can you as a board do to advocate on behalf of this health department and then public health in general? So for example, if you all decide that this is something you want to champion during your terms, like what will be your legacy as board members for this board? What is some certain things you're going to walk away saying, on my time on the board, we were committed to seeing this advance, right? So if it is seeing us align with hospital systems, then what are you going to do? Are you going to call for meetings with their board? Are you going to write letters? Are we going to make certain requests? What are we going to do to make those requests actionable, right? There's a lot of superficial things. I've seen boards. I served on this board, so I'm not just speaking at you guys. I was a board member before I was your health director. And it's like, you can write cute letters all day and publish them in the newspaper, but does that really make you feel comfortable that you've done something actionable on behalf of the community? Or do you think your role is to empower us to move that through? Are those two things happening in parallel? I just think having some really thoughtful conversations when you're outside of this very cute buffer period we're giving you to constantly orient a newer board into, okay, what's the actionable way forward? And I see that in this board, because I mean, day dot, Morgan was like, hey, HR, all of HR at WashU, come here and meet with Michelle Turner. You know what I mean? I've just seen a lot of you, my OGs and the newer members, and even the way that the president and vice president have been so thoughtful about just making things actionable already through committees. I just think this is the board that's going to take all of the work of the boards before and show how a board can move forward in initiatives. So Liz, that's a great question to get this started. I'll go to Colleen and then come back to you, Liz.
Thanks so much. First, congratulations, Rhonda, for a long tenure. That's pretty amazing. And for the presentation. My experience with accreditations is that oftentimes the surveyors will go back to the most previous report and sort of look at where deficiencies or areas for improvement were. Is it possible for you all to share with us the previous assessment so that we can prepare ourselves to answer those specific questions directly?
It's a fantastic question. Rhonda, is that something we can do?
Yeah, we can share that. That's not a problem.
And can we make it easy to highlight where the deficiencies were so they aren't like parsing through 200 pages trying to figure it out? Let's try to, maybe you and Natalie can work to just make it digestible for them.
Yeah, we do have like a summary report, which has like the site visitor comments for the specific measures that are in that report. And Perfect. Those are, and that focuses mainly on the areas that we were the weakest. Yes.
That's a fantastic idea. Thanks, Colleen, for thinking through that. Liz?
Okay, so I asked a lot of questions, so I hope that's okay. As I get an answer for one, I tend to have a few more that stem out of that. But as we were talking about kind of some of this alignment with different systems out there, I guess I'm just kind of wondering how this would connect in with things like the anchor network that's out there with the different health systems. Because what I've just observed in my very short career so far in healthcare is a lot of people have similar ideas about what we need to solve. They might even go about it in similar ways, but a lot of times they're not partnering. So I'm just curious, and this is me just needing to understand more, is how do you connect in with an anchor network? And then I have a follow-up question about, have there ever been kind of joint efforts? And it could be like, you know, holistic kind of plans, right? We're going to tackle this thing. So we're going to go out there with a whole suite of things, including like outreach and education and events and things that are more collaborative to really show that we're showing up together. So I apologize. That was like multiple questions in one, but I'm very curious.
So we have, and I could talk a little bit more about our action teams, I guess, and our work plans, because these plans are developed by all our partners, and we have probably at least 60 partners throughout the region, basically. These, they look at the strategic plans they have within their organizations. Sometimes they'll develop new plans to tie to our plan, or sometimes their existing plans, they highlight how what they're currently doing existing will tie to our goals and objectives. And so as we meet as the action team, they discuss these objectives and what these different organizations are doing, and then how to partner better on those activities. And so we might have 2 or 3 different agencies with similar objectives in their strategic plans. So they're reporting on and all, working as a team, and they keep each other informed during our meetings of the activities in order to better work together cross collaboratively. Did that answer your question?
It did, and now I'll pause. I think I saw a hand go up, but my desire is always for people to really work together.
Yeah.
And maybe we focus our energy and we really make, which I think we're all.
Yeah.
I think I'm preaching to the choir. So
I think I hear where you're coming from, but we do have to rely on a lot of voluntary support from these organizations. We don't have funding to support these activities. Occasionally they will do a grant, and different partners will work on a grant together for funding and work that way. We're not to that stage yet, but yeah, we do have some limits because of lack of funding.
I think foundationally, this is always going to be a challenge. We're asking people who have full-time jobs and responsibilities. This is a volunteer position, first of all. Second of all, we're asking people who are very divergent sometimes in either the way that they prioritize things or the way that they implement things. I'll tell you that while it was mostly smooth, there were a lot of disagreements about the priorities, for example, amongst 50 different partners. There's partners, I know at least one partner who left because they weren't happy that their priority was not, prioritized in the way they thought was best, which is unfortunate and disappointing, because I don't believe that that's the way we collaboratively work together. But it just underscores that it's complex at the basal level. And then I'm just really big on foundations being foundations. So before I ask people to crosstalk, are the basics even there? Are we clear on just the meaning of the priority, the objectives, and how you're going to measure them? Because I believe if you don't have that strong, anything that comes after that by way of projects, work, cross activity is not going to work. So I think a little bit of patience in this formative year to make sure that A, without a successful site visit, all of this goes away, and B, that those foundations are together. But Liz, I couldn't agree with you more that after that, we really have to push for cross-talking, cross-collaboration, because these things don't exist on islands. So I think that's a critical point. So I'd love to hear more brainstorming about how we can do this. I would say that Rhonda and her team were truly innovative, bringing a lot of Shantae's talents around how to bring people together in community ways. The way that launch went has never been done before. We had screens across rooms. We had tables people could visit. We made it a truly interactive, easy space for people to come. And we got a lot of feedback that people had never seen that before. And they learned things or realized things that they didn't. People were meeting in real time and doing business because of us, right? So it was like this very active fair that was constructed with a lot of thoughts, with epidemiologists doing most of the talking, made sure to get support from the mayor and Sam Page on site to show that this is a big priority. A lot of thoughtfulness went into kind of setting us up for success. And I think there's other innovative ways to keep moving this forward. Craig, you've been putting some really
thank you so much for answering that. Because I have noticed even in, I'm going to say in my role, where sometimes we're not tackling that complicated of things. It's the bringing together of the people and getting people aligned that is such a challenge. So I'm going to pause as I see a lot
So,
of comments.
I think this
and-
is the team to do it, but again, I think this is where the board can be like, hey, accountability, what are you doing? When's the last time? Are we getting a report? Can we see, next time we see you, can you tell us if these people have met? Like, I think that's some of the ways you can be thinking about your role too, but I just love the accountability. Craig, you've been putting some comments in the chat. Just want to speak to them, please.
Just that those are the important questions, right? And so the hospital systems have been struggling among themselves to come together because they've all had a different schedule. They now this year are on the same schedule. They were sort of the last time, but even more so this time, even in terms of how they're surveying people to try to get other languages in place to do those surveys. I know that the hospital systems now are looking, and we've been looking for some time to try to get together on that. So the community health needs assessment of the hospital systems is on a 3-year schedule with the IRS. We're on a 5-year schedule with the public health accreditation board. So, but there is much more than chatter. Karen Bradshaw and others have talked about the significance, and I know our director, and I hear from the county director as well, and obviously Natalie and Rhonda and everyone around this table, Shante, and Gina Traver and all the folks over in St. Louis County. We've all been talking about how do we get on this together. It's going to take people not only talking about it, but bringing resources. Many of those resources are with our hospital systems and in the community, along with just a few resources from the local public health systems to put this on the very same track so that we could together have a 3-year cycle. And it will take a little extra effort, but we could do it in 2027. That's what I'm looking forward to. Thank you, Director.
I just love the wealth of experience you bring in, the thoughtfulness. I think one of Craig's superpowers that he brings is he really kind of cross connects across systems and partnerships and people. And so that's also going to continue to serve us well. Kristen?
All right, yeah, Liz, I was gonna, and it's been said, and just kind of reinforcing, I sit on the maternal child health committees, and being there, I noticed that a lot of our community organizations are represented, and I think that's incredible. And I have seen for so many different reasons, competing priorities is one of them, a lag in the systems engagement, which to your point, my concern sometimes is do they often respect the expertise and the efforts in the space to prioritize a time when we can get together to really talk about what the needs are. And I think our system is still, I know that our systems are behind on what it means to implement actionable plans that really elevate community and expertise voice of those who work closely with the community. It's almost like when you're in an organization and you're frontline, but your boss's boss's boss is telling you how to do your job, but they've never done your job before. So there's a disconnect in trying to understand what it takes to be frontline and what it means to really serve people with a very traumatic lived experience and what that means to engage with a system that has so many steps. And so I think there is some roles. I was asked there's a health system collaborative that Mercy has, because I know that I was expecting to see Mercy and I haven't seen them as much as I'd like to. And even just the process of getting on, they invited me to sit on this health leaders discussion, right? But then I haven't seen any action behind it. So I think we have a lot of good names for committees that they say they're doing these things. And again, I know hospitals are busy, but I do think if there is a role, if you do have systems connection, I think leaning into, respecting the expertise of what it means to be a part of the health department, the coverage and wide landscape of resources and who they're accountable to, and needing to have intersectionality in our efforts, because again, to your point, until then, you're going to be doing this thing, I'm going to be doing that thing. And then your volunteering doesn't have to be so robust if we actually work together and utilize our resources in a meaningful way that can actually preserve and be more effective over time, right? There are skills that they have that, they could share with us. Don't even get me on my soapbox. So I'm gonna slow down on that. But yes, I think there's opportunity in some of the committees that you've seen. I actually joined by interest. I think it was during a board meeting where I'm like, I do some maternal child stuff. So, can I sit in and just kind of listen? And it's been great. They do have a lot of partners. And I do think that to learn what other people are doing in the region is so critical and important. And hearing from community members like, hey, this is where we feel like we're ignored in this conversation is also super great. So I think if you are on those committees, I would also charge to continue to hold a space where folks have choice and voice and they're able to elevate the things that are meaningful and concerning to them, because that could also inform the goals and objectives and how they're accomplished in the plan.
Couldn't
So-
agree more. It's so wonderful. The shady smile you saw it's so lovely when I don't have to say things and other people do. Let's just reiterate, respecting the expertise of community leaders, reiterate respecting the expertise of public health departments, and crosstalk. But one thing I would like to say is the first piece of homework for the board from today is, are any of you in a position to serve on one of those committees for the CHIP action plan? You saw that there was a vacancy for co-leadership. Are any of you in a position to? And if the answer is no, which is a valid answer, can you use your networks to make sure your colleagues who may be really good fits know that these vacancies are available and know that they can serve on these action boards? So if you're paying attention on the PowerPoint on what are we doing now slide, the number one was we need new members to join. And then you also saw a vacancy. So I really hope everyone is using their notebooks right now or their online notebooks to just jot that down, because you're going to send those emails out today. Aren't you guys? God, I have the best board. They're so busy. They're just emailing things out for me. Wow. How blessed am I? Any other questions before we move on in the agenda? Fantastic presentation, Rhonda. Thank you so much to you and your team. We will get these slides out to you. You will continue to do homework because you will read the next steps. You will read those 2 slides that Rhonda sent that she didn't go in detail. And you will also look at those mock questions, because we will be asking some of you. We'll also ask that everybody right now, puts a hold on their calendar for August 28th and 29th, because you won't schedule a lot of meetings, because you will keep that open in case you're asked to be available for these very lengthy Zoom calls. But remember, yours was only a 30-minute. So when we get the agenda for when your 30 minutes is, you'll have availability. Why? Because you put a hold on today, right now, on your calendar for August 28th and 29th for the site visit for the Department of Health. Oh, I just love when a plan comes together and everyone is typing their hold on their calendar at the same time. Back to you, Vice Chair, President, CEO. I don't know titles, but you are the vice. And back to you.
Funny. Thank you, Dr. Madi, and thank you again, Rhonda, for your excellent presentation. And I would also encourage board members, if you have any questions, there's several documents that they have that are public facing that you can go deeper. And then please feel free to reach out to Rhonda or anyone that's been here for a while to help kind of support any of those inquiries. So now that we have quorum, I'd like to make a motion to approve the meeting minutes from June 20th meeting, the Zoom video. So motion to approve those meeting minutes from last month.
Second.
Okay, meeting minutes are approved. And then I'm going to move down to the next agenda item, the department.
Just for the formality, since this is live, can you just call for folks to say aye, nay, and abstain?
Oh, yes, yes. I knew there was something missing. I was like, that didn't feel like it was right. All in favor?
Aye.
Any opposition? Thank y'all. Thank you so much. Now the meetings are officially approved. I'm going to move to the next agenda item with Dr. Madi going over departmental updates. So back to you, Dr. Madi.
Can everyone see my screen? Okay, little preview of what's coming out tomorrow. So I just want to tell you about the amazing work that Shantae has been doing, and Aaron Ford, who champions this monthly report. Shantae took a lot of meetings last year to talk about how we can amplify who gets this report. I just as quick background, I implemented this report for the first time in the department's history about 2 years ago. Wanted to be both internal and external in its impact. Internal, getting managers used to measuring key metrics and using those metrics to guide how they evaluate and strengthen their programs. Externally, to increase health literacy, to increase accountability, to increase collaboration. However, it was only going out to just over 100 people, and most of them were like citywide stakeholders, the mayor's office, other department heads, and the board of aldermen being key, but then some key sector leaders like school leadership and other people. But Shantae has now grown this using a new platform to now a listserv of, Shantae, how many people? Over?
I'd like to say about 579.
Yeah, so still growing. So if you could email Shantae any key stakeholders that you believe should be getting this report across the region, I'd appreciate it. Just the name of the person, their organization, and their email address, a list of people. She'll add it to this. She now is using a platform where she can have reports. We know how many people get it. We know the open rate, and the open rate has been phenomenal. We've already gotten positive feedback from leaders who weren't getting it previously, who are really happy. So we've expanded the reach of the report. So just congratulations to Shantae and Aaron. And the ones that really warm my heart are leaders saying, this is modeled how we should be doing business, or man, I really have a deeper understanding of what it is you all do every day. So as usual, the few words from me in this first making an impact slide kind of summarizes some of the key things that happened in the prior month. You will see towards the end of the report an amazing impact report from our HIV prevention team, who had easily the largest showing at Pride from community partners. They'll give you numbers of how many condoms, safe sex kits, hygiene kits, Narcan kits. We, for the first time since pre-COVID, we're testing people for sexually transmitted infections and HIV on site at Pride. The numbers are just staggering. We even had, unfortunately, one positive diagnosis that we were immediately able to link to care. So don't tell me the community outreach by public health departments is not a real impactful thing. That was in a heat wave. My team is the standard. You can't touch my team. It was beautiful because we also showed how the money from ARPA can go into buying vans. Those vans were on site. That is where we took people to air-conditioned places that preserve dignity, remove stigma, gave confidentiality for the testing. So please take time to look at that report. Congratulations to the newly promoted Tyrell Manning, who was on this call earlier, whose team championed those efforts. He, for the first time, also brought together all of the partners that we fund at the health department to be on site to do the work they do. So it wasn't just about us. It was just beautiful, joyful. If you've been following our socials, they've been doing a lot of cute videos as summaries for you about how that was. And that's a big part of this impact report. Mentorship, people also wonder, what do I do besides talk to you and hype up my team? A big part of what I do is teach and mentorship. I want to just shout out one of the biggest groups that we mentor here at the health department annually, led by a visionary researcher, HIV researcher and collaborator in the region, Dr. Juliet, and I'm going to butcher her last name, so I won't, who leads a STAR program. This is a program designed to support the next generation of HIV and public health related researchers. Leaders, young people across the country get to apply, come here on site, and to go through this course over a specific period of time. But there's an on-site time where they are here with Dr. Juliet and her team. She does a lot of global. She's the highest funded HIV researcher in the state, and she is a credit to the region. She has global programs between here and Nigeria as well, but this particular program is for young leaders to develop them. And so she came to the health department modeling what a top tier researcher shows the value of local public health. And so they come and they spend time in our HIV prevention team. They volunteer, they learn, they spend a lot of time with me doing active mentorship. So this beautiful picture is when they came to say goodbye to me, hugs, cries. One of them wrote a comic book on me about Mati, the public health warrior. So you know I was weeping, and she's 11 years old. And but the rest of the team are young folks in tertiary academics who are doing active research project that Dr. Juliet mentors. But she's holistic in her program and in really building them up on a personal level, but also professionally. And so that's a gorgeous picture of us outside. That was a heat wave day, and so we were sweating our what's off with the arch in the background. And the last thing is just to shout out the health department. Do you know what it's like here when on one day it's the record high temperature for the year, and then the next day there's floods? What we have to do to mobilize our partners to make sure that people are safe, call Ameren, prioritize the elderly so that they can get their oxygen machines are working, work with our partners like Heat Up, Cool Down St. Louis to make sure we can get fans one day and turn on their electricity the next day for utility assistance. Shantae's team have built a beautiful packet that we've had on socials and on our website. If someone could drop that in the chat right now around heat safety, where the cooling sites are in the city for our unhoused, and then we get those resources out to other city departments. So just know that the health department is working overtime, specifically Shantae and her team and our emergency preparedness team when there's extreme heat. So I just wanted to acknowledge that as a point of pride. And then the same bureau specific metrics are here. Read them every month because the numbers do change. Read them every month because we may tell you a program or something that we're doing, right? This is not always the same. So it's important that you look and you start training your mind to look for where we're improving, where we're going down. So this is not just a copy and paste each month. These are month specific metrics with associated programmatic updates for every bureau. So please read those. I won't go into them right now, but I will draw your attention to two last things, which is, again, the mentorship, the value adding way that the commissioner and I lead here is to, again, grow our managers. So you have a brand new spanking leadership team in our communicable disease, one of our biggest bureaus. Veronica Roy, an OG. Fun fact about Veronica is that she has a child and a grandchild who all work at the health department at the same time. So we have generational by St. Louis for St. Louis in our very own health department. Veronica is one of the longest serving people here at the health department alongside Rhonda, and she just got promoted to the manager of this bureau. She is being trained by Suzanne Alexander, who you all know and love, who is now taking a position around QI and process improvement and program evaluation as well, which we're excited about. And then we promoted from within Tyrell, who immediately broke records at Pride. So we know we made the best decision there. And who recently, if you remember from last month's report, was invited to DC to talk in front of Congress about the work we do. So we have national impact. Come on, national. And then we hired from externally an incredible leader in the public health space, Regina Sullivan. And it's always incredible to have someone from outside say they're coming in specifically because they see the incredible work we're doing here and they want to be a part of it. So this is your new communicable disease leadership team. I'm hoping to talk to April and Kristen about inviting you guys here for a tour to break bread and to continue to bond as a newer board before the end of the year, and you'll get to meet them. But just congratulations to these internal promotions. And then this is the page I want you to pay attention to. They've put in infographic ways some of these impactful numbers about how many safer sex kits at home HIV tests, how many people we connected to PrEP on site, the reactive HIV that we link to CARE, Narcan kits that were brought out. All of these numbers are here for you. And then upcoming events, the Urban League is doing their annual huge at the Dome back to school and community empowerment festival. Our vans, our tables will be on site. We'll be testing children for lead. Thank you to Shantae for leading those efforts. I will be speaking on the Save Our Sisters Women Empowerment Summit on July 20th. So if you want to come by, I will be in the house. And then August is also coming up, National Breastfeeding Month. So let's be thinking about ways we can support organizations that promote breastfeeding for those who are fortunate enough to be able to. I will stop there. Happy to take any questions. And then Shantae and the team will get this out to you by tomorrow at noon, as always. Thank you. Questions? Colleen, you have a question in the chat if you want to unmute.
Okay, sorry about that. I was wondering, in light of the recent Supreme Court decision regarding the rights of unhoused people to exist outdoors, if the health department is expecting any changes in policy that we as a board should be thinking about?
Yeah, thanks for asking. I think I've told this board, but for newer members, it's worth repeating. The mayor hired a policy lead who sits in her office, Casey Milberg, who comes to us with state level policy experience. She champions. So for the first time since I've been here, I reliably get at our cabinet meetings policy updates from Casey Milberg around what's happening at the state. It's complex in that once that decision was made, Colleen, I think it's important for me to understand from Casey's leadership first, what's coming at the state level or not coming, and that can kind of drive local policy decisions that can be made. It's also worth, again, reorienting new members to understand that unfortunately in this city, the Department of Human Services is separate from the Department of Health, and the Department of Human Services oversees the unhoused. So Adam Pearson, a phenomenal partner and colleague of mine, has that under his awareness, has already been in talks with the mayor's office and Casey, and then will bring me in, because I believe on this topic, our two departments obviously have to be working together. But right now we're just kind of reeling, first of all, and then trying to figure out what's coming that could impact what we can do at the city level. I'm open to suggestions, questions that I can take back to Casey in the mayor's office and to Adam. For those of you who are clearly passionate about this topic or are knowledgeable. So Colleen, if you can shoot me an email, if you're interested with any specific questions or specific things you think they should be working on, that could be in people's blind spots, and that goes for anyone else on the board. I'm happy to champion that with Casey, Adam, and of course myself. But thank you for bringing that up. There's another question in the chat, I think, from Kristen.
Yes, I was just curious for the big back to school event that you all are participating in, if you know that physicals or vaccinations will be a part of the offerings.
I know that the Urban League and the CDC, actually, that they liaise with, were trying to get this done. There was a lot of turnover in leadership at the Urban League that may have made this difficult to do. As you know, the health departments were put in a position to no longer be the primary vaccinators. And so that now lies with the FQHCs. The CDC made that decision through the Bridge Access Program and other programs. We're obviously working to make sure that in the city we have the capability to do this reliably. But we connected the Urban League with the FQHCs. I just don't know if that effort was able to be made. I will say they were responsibly also making decisions about this because the CDC has said a new vaccine is coming just before school. So, you know, you have to think about, is it responsible or the best decision? Everyone should make an informed decision. So I think choice is the answer here. But for people to think that this is the vaccine they should go with, and then to find out a month later that there's a new, more updated version. So the last time I met with the Urban League around their preparation around this, that was where they landed. I don't know, Shantae, if you have more up-to-date information on if vaccines are going to be available.
I do not, unfortunately.
If they are not, Shantae and I will be trying to put together packets of information about where vaccines are available across the city for parents, people who give birth to, and people who give birth to children, especially before school, because many of you are probably aware of a lot of people have COVID right now. We just got a health alert from the state around influenza, and record numbers there too for this time of year where you typically don't see them. And so we will be pushing especially childhood vaccinations, but vaccinations for all in the coming weeks. Does that help, Kristen?
Absolutely, thank you.
Any other questions from my report or in general? Great, back to you, Kristen.
Thank you, Dr. Mahdi, for your report. I'm going to move to the next agenda item, which was announcements, and I only have one. I guess I have two. Just a reminder to check your emails, board members, for your committee chairs. So Dr. Imbal is on the academic partnerships, the chair of the academic partnership committee. April Mickens-Jolly is the chair of governance and nominating, and then I'm the chair of the community engagement. So we are trying to do efforts of making sure that we can get time on the calendar so we can talk about ways that we can support the department. Shantae, I'll likely be connecting with you to see what we could do as a committee to support your efforts to launch your programming or the efforts that you have planned for that sector of the work. And if there's no questions for that, the next meeting is going to be Thursday, August 15th at 8 a.m. Same place. Dr. Mighty, do you have any announcements before we adjourn today?
No, just really, really grateful for such an active board. Newest members, it's just rare to have you hit the ground running this hard. She doesn't like this, but I would like to shout out our commissioner, Victoria Anwuri, on this call. She has been working on some really critical deadlines on behalf of this department with not a lot of information and wielding the team. And a lot of times when you guys don't hear from her or see her, it's because she's doing this critical work. So met a huge ARPA deadline, working on a huge state level deadline that impacts our ability to keep advocating for more money and just to be stronger as a health department. So if we could just show her some appreciation and as we spur her on after meeting successfully one deadline, marching towards another, I just wanted to show my appreciation for our commissioner. Outside of that, that's all I have, unless Victoria or other members of the health department, do you have anything? All right, so Colleen, we did your suggestion around the last report from accreditation. We'll also give that to you guys separately in an email just from the board with the slides from today. Thank you for that suggestion. That's all I have, Kristen.
Okay, well, looks like we'll give back about 22 minutes. And so I would like to motion to adjourn the meeting. Do I need to do a motion to adjourn? Then we can adjourn.